a presentation of 13ABC Action News. Now, your table is ready. Join 13ABC's Jeff Smith with the decision makers of Northwest Ohio and Southeast Michigan. This is the Roundtable.
And good afternoon. Thank you once again for joining us here on the Roundtable program here on 13ABC. I'm Jeff Smith. Coming up in our second segment, sitting down with columnist Keith Burris from the Toledo Blade. Been looking forward to talking to him and some of his take on what's going on in the Glass City in Northwest Ohio in just a moment. But first, joining me is Professor Joe Slater from the University of Toledo College of Law. Thank you so much for spending some time with us.
Thanks for having me. Glad to be here.
I brought you on here today because I wanted to discuss at length, give it a little more time to breathe on this issue of tobacco use in the city of Toledo. Toledo Mayor Mike Collins, as we have discussed, looking at new employees down the road and saying, if you smoke, if you use tobacco products, we don't want you working for the city of Toledo because it is a drain on our economy. What do you think? Is he within his right to do this, first and foremost?
Well, it's a fascinating issue, and legally he is within his right. There's about 25 states that protect smokers in the workplace. So you can't discriminate against people if you smoke, but Ohio is not one of those states. So legally he can do this, but that doesn't answer the question of whether it's a good idea. And there's really strong arguments on both sides. Of course, the people pushing this would say it's healthcare costs, right? That's the main thing. And others might say that the employer wants to present a certain image to the public.
Okay.
On the other hand, employees, unions have an interest in privacy, have an interest in being able to do things that are otherwise legal and not being discriminated against for that.
Yeah.
And you could also say that Toledo could lose out on some really good employees who happen to be smokers.
Now, this is another case where we heard this week, as the story came out and kind of fleshed its way out, we heard people saying, here's another example of government shoving this down our throats, forcing this on us, a mandate, if you will. You see it that way?
Well, yes and no, because when the government acts as an employer, it's not acting, as it were, just in terms of regulating people in a public park. I mean, the smoking ban generally is probably a better example of that, although for what it's worth, I supported the smoking ban. I think it's working out well. But here the government is acting as an employer, and all employers have a certain number of rights to manage their workforce as they see fit.
Yeah.
But on the other hand, employees have rights as well.
I wanted you to give the audience a little bit of your background because in the labor field is where your law is focused, yes?
Well, sure. So I teach labor and employment law at the University of Toledo College of Law, and I've done that for 15 years. Before I did that, I practiced labor and employment law in D.C. for about 12 years. And yes, these sorts of rules in general, when employers can discriminate legally against employees and when they can't, is a big part of what I do.
Per capita, Toledo has a large amount of tobacco users.
Yes, it does, and that gets me back to my other point. There is a risk, even from the employer's point of view, of losing good employees. I mean, I'm not a smoker myself. I've never smoked. But I have had coworkers who smoke, and I know have friends and relatives who smoke, who have been very good employees. So there's a cost issue there potentially.
Does this open a slippery slope? Mayor Mike Collins, and we're going to hear from him in just a second. Mayor Mike Collins says, you look at the struggles that the city faces from a health standpoint, and that's dealing with diabetes, dealing with cancer, and also dealing with cardiovascular issues. Does this, I guess, promote a slippery slope where all of a sudden, okay, if you drink X amount of drinks per week, you can't work for the city?
Absolutely. That's one of the other objections to this policy, is the slippery slope question. What if I have a body mass index of over a certain amount? Again.
And we had a food czar at one time who was looking at getting Toledo back to fitness.
Sure. I mean, there are lots of
But that didn't last.
Yes. There are lots of habits that are, unhealthy habits or potentially risky habits, and you say, well, smokers as a group, yes, they are probably going to incur more health care costs as a group than non-smokers, but so are people who have BMIs over a certain number, or people who drink, as you say, or maybe
Yeah.
people who have dangerous hobbies. Now, some of these things are going to be protected legally. Some of these things are going to be considered disabilities. A few of the things you listed would be considered disabilities under the Americans with Disabilities Act, and you could not legally discriminate against people that have disabilities. But a number of the other things you mentioned,
Health ailments are disabilities, you're saying?
some types of health ailments
Yeah.
are. It depends how it's defined under the Americans with Disabilities Act, but certain types of serious medical conditions that impair major life functions, that's the legal rule, those would count as disabilities, and you couldn't discriminate in certain ways under the Americans with Disabilities Act. But smoking is not one of those things.
Yeah.
But again, your question is good, because smokers could say, well, look at this person who's significantly overweight. Look at this person who drinks a lot. Why are you hiring them and not
Right.
me?
But then we get into kind of an adolescent argument there, don't we? As far as the kid saying, yeah, but Billy's mom says that he could do it.
Sure.
And I'm sorry to all the Billies out there.
And there are employers who have drawn the line. I mean,
Yeah.
there are a number of employers in Ohio and elsewhere that have said we're not going to hire smokers. ProMedica, the Cleveland Clinic, Union Pacific. So it's not impossible to say this far and no farther, but it's
Yeah.
still a question.
We caught up with Mayor Mike Collins just before a city council meeting earlier this week. Here's what he had to say. Wanted to share it with you there at home.
I support it because the evidence is overwhelming. I mean, realistically, the issue becomes an economic issue. If you change a culture and improve the conditions of the environment, you control your healthcare costs. If you allow the environment to continue into practices which are contradictory to good health, then your healthcare costs go up. When your healthcare costs goes up, who's going to pay for it? The employees are going to ultimately have to deal with a greater amount of cost for healthcare benefits. So having this drive from the employees saying, we want to participate in controlling the healthcare costs, and this is one of the things we can do, I believe is a positive statement. I'm not God. I don't govern what they do with their personal lives, nor will I ever participate in that. But what I am responsible for is the city and its financial ability to meet the needs of the citizens and the employees.
And I want to put some context to this as well, Joe. Mayor Collins went on to talk about, he was a former city employee as a Toledo police officer. He was the former head of the Toledo Police Patrolmen's Association. He was part of what was called a cost containment committee. And that committee still exists today, as you and I were discussing, looking at ways the city can save money. This was one of them. This was one of them from a standpoint of making its employees healthier by making better life choices. Is this just the wave of what cities are doing, and are they within their legal rights to do so?
Well, first, what's I think interesting about Mayor Collins' quote is he focuses on costs, and that really is the driving issue here. I mean, the U.S. is almost unique in the industrialized world in having medical care costs paid for by the employer.
Let me interrupt you for a second, too. When this first came out, all I could think about was New York and banning large soda pop and things of that nature, which initially cost was not a big part of the conversation. It was all, you need to be healthier, folks.
Right, and that's another part of it, is the creating a healthy culture, the image of the employer, as it were, as we were talking about earlier. That's another piece of it. And the third interesting thing I heard Mayor Collins say there is that he, as you were just saying, has been getting input from the employees, because even though it is legal to impose a policy like this in general, there's no law, as I said, in Ohio that says you can't discriminate against smokers.
Yeah.
On the other hand, when you have unions, these are typically sorts of things that you'd either want to negotiate about or at least get their input, and I'm glad to hear he's doing that.
He is talking with AFSCME here locally. I know that they were involved in the discussions. He said that he would consider it, and this was kind of a paraphrase, he said he would consider it an unfair labor practice to put a mandate into a collective bargaining agreement. So this is not something which they are just, as I said before, forced down the throats of employees. Also wanted to point out to you there at home as well, this does not include fire, TFD here in Toledo, because they are self-insured.
That's interesting. I didn't know that. Yeah, and I agree with Mayor Collins' assessment that just unilaterally putting this into a contract would be, as you say, an unfair labor practice, which would be a violation of state labor law.
So let's talk about other cities around the state and what we could be seeing if they are watching this closely as far as what happens in Toledo, because as we said, there are a few loopholes this bad boy's got to go through before it goes into action. But do you see Columbus, Cincinnati, the three C's following our lead on this one?
Well, I don't have any inside information, but I think certainly to the extent that they are also trying to control healthcare costs, they are going to be looking at similar measures. And then the question is, again, where do you draw the line? Is it just smokers? Is it some other bad habits? Again, we have a number of employers who have drawn the line at smokers. Another question is...
But those cities have to look at their books and figure out, do we have anything on the books right now, legally speaking, that would keep us or prevent us from implementing this?
Right. The state doesn't have a law. I'm not aware of any cities within Ohio that have a law that ban discrimination against smokers, but cities that had unionized workforces would almost certainly have to negotiate with their unions before they can implement something like this.
In our last couple of minutes, we had also discussed the fact that those who are already employed with the city of Toledo who smoke, use tobacco products, are grandfathered in. They will not be affected by this. Do you see that as something that will stay put? Because we talked about there's kind of that, you're already into the system, however, we may lead you to understand we'd like you to be healthier. Yeah,
so there's positive ways to do that and more negative ways to do that. Obviously, this raises the question, how are we going to tell if someone's smoking? Is the policy going to be you can hire someone who's not smoking and then they start smoking? How long do you have to not be smoking before you're hired, before the policy will allow you to be hired? There's lots of details that have to work out. The positive approach...
And for a lawyer, you're going to have A1, AB, you know, all down the line, asterisk, 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 down the line.
Anything that makes work for my students is good for me, as far as I go. But more seriously, I think that, first of all, they're going to have to figure out how to write those rules in the policy. But the more positive way to go forward, I think, is to be pushing smoking cessation programs for current employees and trying to give them positive incentives instead of going around trying to sniff their clothes to see if they're really smoking.
Well, I know as this being part of your field, you are going to be watching this closely. We appreciate you spending some time and discussing it here with our audience this afternoon.
Absolutely. Thanks again.
You bet, Joe. Good to see you here. And stay right there. We will have Keith Burris joining me here on the Roundtable right after this.